So scar always has a bad name because we don't like them, but scars have been used for different reasons. There are some cultures that actually use scars to try to identify people from that particular culture. Um, Scars, without scar, there is no way wounds would heal. So it's a natural part of wound healing. But when you have a scar in an area that is so visible, particularly the face, then sometimes it calls for us to try to modify them. There is a method that you can make a scar totally vanish. I don't think that is, can be done except for in fetuses, but you can make a scar look better. So in the face, if you have a scar that doesn't look right, the first thing we do is to see what are the features of that scar that makes it unattractive. It tends to be one of a number of things. One, it's too long. Two, it's too wide. Three, it's not the right color. It doesn't match with the surrounding area. Four, it is depressed. Five, it's maybe hipped up. Six, it's going against the normal direction of the facial wrinkles. Okay, so when you present with a scar and you want it modified, we look at the scar and say which of these features makes it an unattractive scar, and then that's what we try to correct. Some of these features are only correctable with surgery. Others could be resurfacing, like using a laser or what we call a dermabrasion. Others, if it's a depressed scar, you can fill it in. So you look at all these features of the scar that are not desirable and you try to pick the solution that will allow to make it look better. Most chicken pox scars are depressed scars. They leave a dent. It seems as if somebody took a punch and took out skin. So you can treat them one or two ways. If it's depressed, what you do is you can fill it in and bring it to the same level as the surrounding area so it's not so visible. If it's depressed and really big, you can cut it out and then close. So you replace one depressed scar with another scar, which is a fine line, but is smooth and even with the surrounding areas. So you can't really make them vanish, but you can improve them by making them blend into the surrounding areas. As I said earlier on, without scars formation, there's no healing. So if you have any injury or surgery of any kind, there is going to be some scar involved. The way we can prevent or minimize it is planning where to put the scar. If it's a surgical procedure, you try to hide them in natural creases. You try to hide them behind hairlines. You try to hide them within folds. So that's one way. Two, in the early healing period, there are things that you can do to minimize scarring. Some of them are topical agents that you use to make them flat. Some of them are steroids that try to minimize how much thick the scar would be. So that's when you are planning a surgery, you have a little bit of control. If you do get a scar as a result of a dog bite or an accident, you can't really plan where they go. But there are certain things that you can do early on to make sure that they heal very well. Keeping it clean, keeping it moist earlier on with ointments, and then later on using topical agents that modify wound healing. There are stages to how wounds heal. And usually about a year after an injury happens, be it from trauma or surgical, the wounds or the scars have matured. So when a scar matures and it doesn't look the way you want, then you can go back and modify it, make them look better. A new scar that has happened recently is still going through changes. So sometimes we would ask people to wait for the scar to mature before we do modifications. And so the techniques you use are not different, it's just the timing. We tend to like to work on a matured scar. If you have a scar that is undergoing changes, you are adding insult to another insult and may make the final outcome worse. But there are times that new scars can be modified with laser treatment, dermabrasion, injections of steroids, use of topical agents. So we pick and choose based on what's going on, but in the end result is what we want. Wound healing in patients of various ethnicities differ. Patients who are of darker complexion, olive complexion, tend to form thicker scars than people with lighter complexion. So you take those two features into account when you are planning an incision. If it's trauma from an accident, you have no real control over it, but when you're planning it, you can plan them such that the outcome is favorable. It tends to have to do with where you place incisions and what you do early. So for example, if I'm going to do a facelift on somebody on lighter skin, I may be liberal with what I put the incision, but if I do the same thing on someone of Asian, Hispanic, and African American descent, I'll be very cautious of where I place the incisions. I probably wouldn't do the same incisions. And if I did, there are certain things that I would do very early in the wound healing process. For example, using steroid injections to modify how the wound heals.